Welcome, everyone, and thank you for joining me for another session of our Village Vitality series. My name is Aline, and today we will be continuing to work on getting into the hips and the shoulders. So we'll be doing some exercises both to strengthen and stretch these areas. And so if you have any pre-existing conditions like rotator cuff issues, hip issues, hip replacement, you just need to be very mindful while performing these exercises. I mean, truly, everyone should be very mindful while performing the exercises, but you guys need to be even a little more on top of it so that you can listen to cues from your body that may be telling you to take it down a notch or to stop that exercise. So some of you may be working with a baseline pain already in these areas. And so your indicator will be increased pain or discomfort, especially if it's sharp shooting or pinching type pain. If it's just a little extra discomfort due to muscle engagement and you're okay with that, then you can work through it. But I really stress that you listen to your body. That's really my only rule when it comes to these classes. And for today, definitely recommend bare feet. We'll be working with some more ankle and foot work, as well as some standing postures that will be beneficial to be barefoot, unless, of course, you've been told by your doctor that you need to be wearing shoes pretty much 24/7. I do have my towel here on the edge of my seat, just in case I want to use it for one of our exercises. And notice that the mat is lengthwise today. And that's mostly for our standing postures that we'll be doing behind the chair. We will be doing a wide-legged posture while seated. So if you prefer to have your mat long or, I guess, perpendicular to the chair, you can. And then you'll just shift your chair forward when we do the standing work. So it's really up to you. Don't panic if you don't have a mat. It's not necessary. The main reason to use it is if your chair slides around on the floor, then you definitely want something that will help grip underneath your chair. Okay, so with that being said, I do want to also mention, you've probably noticed, or maybe you haven't, if you've been exercising with me this whole time, you might have noticed that the videos have slowly been creeping up in length. That wasn't really intentional, but I will probably be moving forward having the videos about an hour to a maximum of an hour and 15 minutes. I'll really try to keep it at that hour because I know you guys might have places to be, but if you can, go ahead and block out time for an hour 15 just to be safe. But like I said, I'll try my best. Now, for today's centering technique, we'll be working with Bhramari Pranayama, which was our bumblebee breathing. Remember, this one is awesome for ears, nose, throat with the vibrations that we're creating in those areas. It's great to lower blood pressure. Those of you already with low blood pressure or actually with blood pressure problems with it being on the lower end, just be very observant of whether you start to get lightheaded. That would be an indicator that perhaps your blood pressure is dropping and you want to stop that breathing technique. But it's very gentle, so it's not going to cause your blood pressure to plummet. So I think it's still safe for you to practice even if you have low blood pressure, just as long as you're listening for those cues from your body. And it's also really good for the endocrine system. That's our glands throughout the body, because it does vibrate a specific part of the brain that regulates those glands. So this is just a really wonderful and really fun and easy technique. So let's get to it. Now, with your seated centering, you can scoot back in the chair, mid-chair, edge of the chair. You want to be comfortable, but at the same time open in the front of the body and also working the body a little bit. So this is not a totally relaxing position. And so you do want to be working the core and the back a little bit to maintain your posture. So wherever you would like to sit, go ahead and get situated, finding your alignment in the joints of the body. So we want that hip width apart with the knees, and then the ankles or heels right under those knees. And go ahead and do whatever you need to do to kind of cue yourself to sit up tall. For me, that's a couple shoulder rolls. It really helps when I roll those shoulders up. I kind of lift everything up. And then when I roll them back and down, I keep the head and spine lifting, but then bring the shoulders down, because we don't want to have this posture for the whole time. So once you have found that nice tall seat, you feel that engagement in the whole core and the back. Go ahead and let your eyes close. And when you're ready to join me for our pranayama technique, you'll be breathing in and out through the nose. On your inhales, just a normal inhale, maybe a little deeper than average. And on your exhales, making a humming sound. And so go ahead and continue that for several rounds at your own pace. So I will continue the breathing, but you may be slower or faster, or maybe breathing right along with me. So keep that in mind to go at your pace, your inner rhythm of breath. Keep going. And if you're working with someone else in the room with you, just enjoying the chorus that we all create here. And imagine how fun this would be in a class full of people. But go ahead and just continue, just noticing what's vibrating, maybe even tickling. So it kind of tickles when my teeth vibrate against the lips. Remembering to keep that core active, but shoulders and face relaxed. So try to relax the tongue in your mouth. Try to relax the lips and the cheeks so that you can really feel that vibration and let it move through the body. Go ahead for 3 to 5 more breath cycles here. Stopping if you need to, if you're getting any cues from your body to do so. Go ahead and finish out the breath cycle that you're on. And then we'll begin to work to release the major joints of the body. So releasing that right hand down, grabbing underneath the chair. Feel free to keep your eyes closed here if you'd like to, or you can open them to follow along. You'll just drop that left ear towards the left shoulder and lean any amount towards the left side, just however far you want to go to increase that stretch. And we'll take about 5 rounds here of just dropping or rotating the chin towards the shoulder and then back to ear towards the shoulder. So slowly moving the chin and then ear. Of course, if it just doesn't feel good to you, then you can just keep the ear stretch or the ear towards the shoulder stretch and hold it there. Or you can keep the chin towards the shoulder stretch and hold it there. We're moving dynamically, though, to just work the muscles a little bit differently and get the joints warmed up in the cervical spine. So again, just slowly moving ear to shoulder and then chin to shoulder. One more time. And bring that ear back to the shoulder. Slowly start to lift the head as you release that right hand. And maybe closing the eyes here, just observe differences between the right and left side. Kind of crazy to feel how different just that one stretch can make our body feel. So go ahead and bring that left hand down now, grabbing underneath your chair, dropping that right ear to right shoulder, and working through several times of dipping the chin to the shoulder and then ear towards shoulder. So slowly rotating in the neck, drawing the stretch to different muscles in the neck. So we're kind of shifting back and forth between our sternocleidomastoid muscle and our scalenes, as well as our upper traps. So those are muscles kind of in the front, side, and back of the neck. Again, just moving slowly, or if the movement just doesn't feel right to your body, holding in one or the other. If you're still rotating, let's take one more. Ear to shoulder, chin to shoulder, and then back to that ear to shoulder, slowly lifting that head up and releasing that left hand. Feeling a little more balanced now between the two sides. Let's just take some shoulder rolls. So you can do both together, or you can do one at a time, kind of alternating, one moving up and down while the other moves forward and up. So either way, working through that shoulder range of motion, but again, being mindful of any increased pain. Go ahead and reverse directions. So either double shoulders, reversing the direction, or one at a time. Well, I keep saying that. It's not really one at a time, but it's just alternating. Try to keep that upright posture. Sometimes we get really distracted by what we're doing, and then we lose that posture. So come back up, find length, and relax. Getting a little bit more into the rotator cuff muscles and the arms and shoulders. We're going to do an exercise called half bow. And so for this one, bring those arms out by the sides. Bend the elbows. So this is kind of our starting point. And we want to try to freeze or lock these arms in place. We're going to rotate the hands up. So again, I'm trying to keep my elbows at shoulder height. And then hands back to start. So rotating up. Trying not to drop the elbows. Probably feeling a burn in the shoulders. That's our deltoid muscles working really hard. Our rotator cuff muscles are working here as well, so we're actually strengthening them and working them through their range of motion. Rotator cuff muscles, we have 4 of them that basically cover the entire shoulder blade, front and back, and connect into the shoulder joint. And what tends to happen is when we have those muscles are weak, and our shoulder muscles are also weak, we can really strain or tear or mess them up. So these types of exercises are great to strengthen. Lift up one more time. Back to start. Relax for a second. Woo! Shake those arms out, shoulders out. We're going to try full bow next. So let me just demonstrate while you're giving those shoulders a little break. And so we'll start in that position again. Again, just watch me for this first round. You're moving up, back to start, and then down. So the down part may be a little challenging. Back to start and up. So we're basically trying to get through the full range of motion of those muscles in the shoulder joints. So here, just be careful and mindful, and also try not to let this happen. So it's really easy to try to lift the shoulder, lift the elbow to try to get that hand all the way down. That hand's not going to go all the way down probably unless you have a lot of shoulder flexibility. So just do your best with range of motion here. Okay, so let's try that, and we'll give those arms a break. So arms out. Bring that 90-degree angle into action. Hands up, back to start, and then down any amount. If you can't go down at all from this position, that's fine. Just keep working with half bow. Make that mental note that rotator cuff is something you need to work on. But try not to make it a negative mental note. Oh yeah, I know y'all are feeling it. Well, we won't do this one quite as long. Whew. Try to stick with it. Deep breathing. Don't hold that breath. One more. You can do it. Don't give up now. Drop it down. And release. Awesome work. Any kind of decompressive movements that you need to here. Let's get a little bit more into the spine and the legs now. So working with a variation of cat and cow using the leg. So here, you may want to grab your towel. We'll be drawing the knee in for cow. So belly forward, chest forward, knee in. And then straightening the leg and releasing down for cat. You may prefer to just grab underneath that thigh, interlacing the fingers. Same motion. So it's really up to you. Try to get as much spinal variation as you can in terms of shape change in the body. Remember, we're inhaling, drawing up and in, and exhaling, closing down. Take one more. And now drawing that knee in. This is probably going to be the only time I ever ask you to cross your legs. Crossing your legs is typically awful. So if you sit with your legs crossed like this, really terrible for your SI joint, your sacroiliac joints on either side where the sacrum wedges into the pelvis, and your low back and your hips. Just try to avoid crossing the legs if you can. We are doing this, though, for the sake of stretching. And so you're just trying to tuck that knee up as high as you can. If you can cross the ankle over, great. If you can't, you're just staying right here. And you're going to grab hold with that left hand. We're going to twist to the right side. And you should feel that lovely stretch here, maybe even into the back. Let's release that twist. Dynamic 2 more times. Exhale to twist. Now at the same time that I'm twisting, I'm also kind of pushing this leg over towards that left side. Let's hold this twist. Don't hold your breath though. Keep breathing. Try to lift and lengthen up. Remember, our twists are only beneficial if performed correctly. So if we're hunching forward, it's not that great for the spine because we want even compression on those discs between our vertebrae when we twist. On an exhale, release. Go ahead and uncross that leg if it's crossed. Bring that foot down. And let's continue on the other side. So either using your towel to thread it under or interlacing those fingertips under the left leg this time. We'll inhale, cow, shoulders down, chest open, chin lifts, belly pushes forward. And then exhale, cat. Rounding out the back, navel to spine, straightening that leg, letting the weight of the leg stretch in the upper shoulders. It should feel pretty nice. Inhale up and exhale out and down. Work at your own pace. You might move faster or slower than me based on your breathing. And if you have pretty shallow breathing and you can't manage to do one long inhale here and one long exhale here, just try to initiate the movement on an inhale for your cow and initiate the movement on the exhale for your cat. But then you can take several breaths if you need to. One more. And the next time we draw that knee in, we're going to stay lifted. Try to cross that ankle onto the outside of the right leg. Hold on to the outside or front of the knee. And you're going to exhale, twist. Feel that stretch. Inhale back to center. 2 more times and then we'll hold. Twist. Adjust here with the knee moving in or over, however you need to maximize that stretch. And last twist, and we'll hold that twist. Remember to try to stack the spine. Deep breaths here. Try to push those shoulders down. Take one more inhale. And on your exhale, you're releasing the twist. Go ahead and release that foot down. Now from here, we're going to do a little bit of ankle work, and then we'll go through our vinyasas. So hands can just come to thighs here. Be mindful of posture, but you might want to observe the feet, and so you can hinge forward a little bit as long as you're not rounding forward like so. So trying to stay upright. We're going to work both feet at the same time. Trying to come up, maybe to the toes, maybe not. Maybe you just stop here, especially if you have osteoarthritis or really osteoporosis is going to be our major contraindication for coming all the way up to the tippy toes. So you want to stop here. There, you're just coming up. Let's add a flex in. So down and then flex, trying to lift those toes and the feet up just to the heels. So pointing and flexing. Really try to roll through the arch of the foot. So even if you're fairly flat-footed, that's going to be a little more challenging for you. But I want you to try to get all points of the foot down and then come into your flexion. And roll through the foot and then come up to your point. And the more challenging this is for you, that's your cue that you need to do this frequently. It's great if you can do this kind of thing every day. Maybe while you're sitting and watching TV, you just work through some of these foot exercises. Okay, one more time. Pointing and flexing. Now we're going to work through what's called ankle inversion and eversion. And it's just a rolling out onto the outer edges of the feet and then rolling in to the inner arches and lifting those outer edges. Your knees will move open and close, but try to not, try to minimize it if you can. So you're trying to isolate into the ankles as much as possible. And just rolling to the outer edges and to the inner edges. So part of the reason why we do this is for ankle stabilization. So we're actually strengthening some of the muscles here that support the ankle joint. But at the same time, we're also stretching. And so, as I mentioned in prior classes, a combination of both flexibility and strength is very important for joint health. We often tend to focus on just one or the other. But when we incorporate both, it's the most beneficial for stability in the joint and injury prevention. And stability here in the ankles is super important, as you all probably know, for fall prevention. And that's something I'm very passionate about in folks in really any age, but especially as we age, because a fall can really lead to a decline in health overall. Okay, one more rolling out. And let's give those ankles a break. It might feel good to do a couple little ankle circles. Just kind of work it out a little bit here. And now that our warm-up is done, let's move through a couple of vinyasas, get a little more heat built up. So if you're not already at the edge of your seat, come on to the edge. We're going to continue to do some work with locust, our back bend. But first, let's take a nice, relaxing forward fold. So you'll inhale your arms up. And on your exhale, decide if you want to keep the arms up, out, or down for your forward fold. Releasing either to here, parallel to the ground, if you should not lower your head below your heart. And you'll know that if your doctor's told you. If you do have vertigo or anything like that, you also will not want to lower the head below the heart. But for most everyone else, allow yourself to fully round down. Let the arms dangle down. Maybe rolling the shoulders or turning the head side to side. Whatever you need to do to really just loosen up in that upper body. Let it be dragging you down deeper into this stretch for the back. Deep breaths here. And on an inhale, start to lift the head first. So coming back to that parallel positioning, draw the hands up to the thighs. And then come up just a little bit more. So you really want to be pressing the chest forward. The back is in a back bend position. So you're trying to engage here in the low back especially. And we're going to send those arms back behind us for locust. Engage the navel, press it to the spine, and we're going to do some side-to-side reaches. This is going to strengthen especially a muscle on either side of the spine called our quadratus lumborum, which is a main culprit for just generic low back pain. So I'm staying in this back bend position, and I'm just trying to reach to the right, maybe even touching my chair, and then reach to the left. right, and left. You may not get anywhere near your chair. That's fine. Keep your gaze down. We do not want to crank up the head here and irritate the back of the neck. Want to keep it neutral, maybe even envisioning like a big old Honeycrisp. You can tell apples are on my mind. It's that time of year, and we live in that area. Know those arms are getting tired. One more push to the left. And on an inhale, come up. Exhale, relax. Shake those arms out if you need to. Good work. Let's continue on. A little bit of core strengthening and then getting into the hip flexor muscles. So bringing those hands in front of us, right hand crossed over left. If this is a no-go for you in terms of holding this position with the arms, maybe bringing hands to a prayer position in front of you is a good alternative. But try to hang out here if you can. Even if it starts burning, that's your shoulders getting stronger. So, really tall posture here. Deep twist from transverse abdominis and external rotator or external obliques. So we're going to twist to the right and tuck that right knee up. Inhale to center. Exhale, twist to the left, tuck that left knee. You should be feeling this on the side you're twisting towards here in the abdominals and in the hip flexors as well. And of course, the arms and shoulders. So a nice little full body effort here. Keep breathing. Try to keep moving. Push that edge a little bit, just within safety and reason here. Now, let's twist to the right again. Hold it here. Breathe. Ooh, yeah. Should be feeling it. Release the twist. Try to keep that knee tucked in. Go ahead and straighten out the arms and the leg and release that leg down. Go ahead and bring those hands behind you. If you would like to get a little counter stretch here for the hip flexors and it feels okay to you, press into that left foot and lift those hips any amount. You should feel a little bit of a stretch there in the front of the body. And we're activating the glutes. Go ahead and release out of that. Just a really quick little counter stretch. And let's move into a hamstring stretch here, low back stretch. So we're set up for it now. Want to make sure we're not locking that right knee. And try to keep length in the spine as you hinge forward any amount. And if you haven't heard me talk over and over again about pelvic tilt, sorry if you have, but you know, it's a good reminder. Really try to rock that pelvis forward at the top and behind you at the base of the pelvis. Oh, just that subtle movement really can maximize the stretch without you having to fold further. We want to hold our stretches when we're passively stretching like this for at least 15 seconds and up to 30 seconds, even a minute if it feels okay and you're not recovering from an injury in that area. Slowly come up and draw that foot in. Now, we're going to work with a pose called goddess pose, which we typically do standing behind the chair. We're going to do a seated version. So we're just going to walk those feet out as far as you can to either side. Because we're not putting weight in the legs, it's not so important that the knees are over the heels, but see if you can find that alignment. You'll probably be feeling a stretch in the inner thighs here. We're going to hold in that space and go ahead and bring those arms up and out to the sides. So as we hold this inner thigh stretch and work in that range of motion, we're just going to rotate those palms up and down. Again, those of you with rotator cuff issues, be very careful with this one. The palms rotated up is a very vulnerable position for the shoulder joint. It has the least, continuity with the humerus in the glenoid fossa, in the where it connects to the shoulder blade. But this is a super beneficial exercise to strengthen those rotator cuff muscles. So if you don't have existing issues and no pain from this, keep going. If you do have issues with this one, just bring those hands down. Just focus on the lower body. Couple more rotations. One more. And down. And bring those hands down. We're just going to go for a little bit of a forward fold to increase that inner thigh stretch any amount. So bringing hands, fingertips forward. Be very careful here. Go slow. So if you start to go forward and you're like, Aline, I'm going to fall out of my chair, then don't go anymore. You can also walk those feet a little further forward if you feel that you need that stabilization and you're going to fall. Please don't. It's not worth trying to go for the maximum effort if you're going to hurt yourself. It's one or two more breaths here. Getting into those hips, y'all. On an inhale, come up. And either using your hands to help kind of bring those feet back in, or just kind of march those feet back into the middle. We'll take one more vinyasa sequence. So on an inhale, lifting those arms. Exhale to fold forward, Uttanasana, keeping that length, and then releasing. Relaxing here for several breaths. And slowly starting to reactivate, pressing into the feet, lifting the head, neck, and shoulders. Getting ready for a little bit more locust work. This time we're going to do what's called Supermans. So holding here, core engaged, back engaged, as much in a back bend with that low back as you can be. Send those arms back. Now, if you can, accept the challenge. We're going to try to open those arms out to the sides and then up overhead. Woo! Out and back down. So let's take an inhale, sending those arms up, and exhale, sending them back. Again, stay mindful. Back, shoulders, how's everything doing? If you're just feeling a lot of like sensation, that's fine. If you're feeling sharp shooting pinching, that's not okay. If you feel like you're starting to let the back round, that's also not okay. Come back here. Let's take one more though. If you're still with it, pressing actively into those feet, you're probably feeling the legs very active here. And on an inhale, come up. Exhale, relax. Nice work. A little bit more abdominal strengthening and twisting. This time, let's cross left arm over right. And we'll twist to the left to begin. So on your exhale, deep abdominal engagement, lifting that left knee. Inhale, center. Exhale, right. Inhale, center. Keep going at your pace. Again, trying to feel that powerful activation and that squeeze of the abdominals, and then release when you come to the middle. Might even want to go with your pursed lip breathing here, just to ensure that you're doing it. Plus, it engages the abdominals a little extra. Try it out if you haven't before, and you'll feel that extra engagement. One more twist to each side. Hold it here, but breathe. Come back to center. Straighten arms and leg. And relax. You're set up now for your hamstring stretch. Make any adjustments that you need to if you didn't quite land in the right space. Micro bend in that left knee. And go ahead and move forward into that stretch. Remember your pelvic tilt. Boop. And that should set you up really nicely for that hamstring stretch. And trying to relax here whatever you can. So you clenching your jaw and squeezing those eyebrows is not going to help you in this stretch. So see if you can make your body a little more efficient. The more release we invite in the rest of our body, we see that affect the muscles that we're trying to stretch. And when you're ready, an inhale will slowly lift you up. Draw that left foot in. Let's take Goddess one more time. And then we have a short standing sequence that we'll work through for balance. So coming to your Goddess pose, walking those knees out as wide as you can. We're engaging the outer hip, stretching the inner thighs. And this time we'll just move side to side with some side-to-side movements to stretch everything out. It should feel pretty nice. So right elbow towards the right thigh as I lift that left arm up on an inhale. On an exhale, coming back up. Inhaling that right arm up. And then coming up. Just moving nice and slowly. And basically the moment that you stretch those fingers out to that maximum length, then you come right back up. So we're moving dynamically here. Good. Now let's hold this stretch to the left just for a few more seconds. So keep lengthening. You can practice your chest opening here if you'd like to. So you're still getting that side stretch, inner thigh stretch, but now we're adding a chest stretch in front of the shoulder. Remember that head can just stay neutral if looking up to the ceiling strains the neck. Come back to neutral if you're taking that chest opener, and then up, and we'll hold down to the right side now. So maybe just holding this stretch, or perhaps opening the heart up towards the ceiling, opening that arm out any amount. Taking a couple more deep breaths here. And slowly bringing that back to baseline. And then an inhale to lift up. Good work, everyone. Let's walk those feet in or guide them in. Coming up to standing, either through chair pose or in any other way that you need to come to standing. So if you're joining me for chair pose, you're walking those heels in underneath you. Heels will lift off the ground for sure. And then you're trying to push that weight forward. Now you're trying to sink the heels down. Arms move forward, so we're kind of helping get a little momentum to rock forward and get those hips lifted up off the seat. But then we're trying to stay here in this yogic squat position for a breath or two. And then slowly coming up to standing. On an exhale, relaxing. And shake it out if you need to. Let's come back to the back of your chair. I'm going to move mine forward just a little bit. As long as you have space behind you where your leg can move out, then you don't need to adjust your chair. So we're coming here to hands on the chair, probably about, with your hip and your chair, maybe about a foot of space. Zip up here, engaging that core. Even while we're standing, we're trying to stack ribs over hips, shoulders over ribs, ears over shoulders. Engaging the core. Shift a little bit to your left. We're just going to push that right leg back behind us and bring it back in. So I don't want to lean forward at all. I really want that glute muscle to work hard here. Back and in. Squeeze that butt as you bring that leg back. All right, let's bring that leg back. And now do a little push-up. So we're going to lean the chest forward, lift that leg behind us, push up. And push up. Good. If lifting that leg is too much, you can bring the foot down and just do your push-ups. But try to get that leg lift too. Last one, we're going to hold it here. And either tuck and extend with just the leg, or if you want to test the balance and you feel okay doing so, an exercise called Nautilus. So you're tucking opposite elbow to knee and extending out. Tuck and extend. Just two more. Either with just the leg, if balance is a huge issue, or both. And try to hold here, warrior 3 balance. Woo! Try not to lock that left knee, so get a little bend going. Drop that right hip down towards the ground. Come up a little bit. And if you are fairly decent with your balance, maybe you're sending that other arm away. And go ahead and release. Oh, left hip's probably really talking to you. Go ahead and take a little stretch over to that side. So we're just pushing into that hip until you feel that nice stretch. Maybe shifting hip to hip. In our cool down, we'll definitely stretch all of this. Promise. All right, so come back up. Reset. We got to do all that on the left side to keep balanced. We're so lucky. Okay, so zipping up, finding that alignment, shifting just a little bit to the right, and sending that left leg back and in. Back and in. Remember, nothing's moving except that left leg. Try to keep the whole rest of the body still and engaged. Let's do 2 more. Last one, keep that leg lifted. Bring those hands down to support you for your push-ups. So you're lowering the chest down, bending the elbows and straightening. wanting to try to hug those elbows in towards the rib cage. Don't let them flare straight out to the sides. So we're kind of tucking back and in. Two more. Oh, I lied. Three more. Last one. Hold here now. And you're either just tucking the knee in or tucking opposite arm and knee. Exhale to tuck. Gazing down towards your chair. Last tuck. Extend it out and hold. Maybe you're just holding the leg. Maybe you're holding arm and leg. And if you'd like to come up and out of this just a little bit, maybe you're trying both arms. But again, please only do that if you're really confident in your balance. And then, of course, you can always grab hold real quickly if you need to with one or both hands. Warrior 3. Woo! Whew. All right, when you're ready to call it quits, I don't blame you. Come on up. Stretch it out a little bit. Get into those hips. We're going to do a little cool down sequence and then relax. Okay, so coming a little bit closer to your chair now. Go ahead and take a little baby step back with that right foot. And you're going to try to rock the base of the pelvis forward. So basically tucking the tailbone. You should feel a nice little stretch here in the front of that hip. If you'd like to, you can kind of lean over towards that left side as long as your balance is okay. And that may increase the stretch for you. Nice work today, guys. Go ahead and keeping the feet pretty much where they are. You're just going to release that tuck, lower that right heel down, and bend into that front foot. So you should feel that stretch now in the calf muscle. Taking a breath or two here. Our calves can get really tight, especially if we never stretch them. So I wanted to throw this one in because of the work that we did today. Go ahead and step that foot forward. Let's do the other side, and we'll take our final stretch. So standing up tall, little baby step back with that left foot. Staying on the toes and just tucking that tailbone. Slight bend in that front knee. Yes. Enjoy that stretch. Or like I've said before, pretend like you're enjoying that stretch. Smile. We really can fake it till we make it sometimes. You may really dislike things in the beginning, and sometimes that is because it's exactly what you need the most. It's weird how it works that way. You know, kind of like with our eating habits. Typically, what we want to eat is not what we should be eating. But what we don't want to eat is exactly what we need. All right, so go ahead and shift to the stretch. Lower that back heel down. Bend in that front knee. Get that stretch in the calf. And keep in mind your heel might not actually touch the ground, but you're just working towards that, pushing that heel down. Try to keep the shoulders relaxed. Nice deep inhales and exhales. And from here, we're going to move into our standing downward facing dog stretch just to get the glutes and the back and the hamstrings one more time. And so you can do that from this position if you feel comfortable, really just stepping that right foot back and then maybe walking those feet back further. But if that doesn't seem feasible to you, go ahead and bring the feet together, and then you're just going to slowly walk those feet back. So remember, with this stretch, we want to keep the feet hip width apart. I hope I don't go off camera with this one. And you're walking back basically as far as you can to get length in the spine. Drop the chest down. Now be very careful here. If you do have shoulder issues, you may want to really just stay up and don't drop that head below the shoulders. That might just be a little too much strain. So play around with it. Now here, that pelvic tilt is super important. So if I tuck my tailbone here, I'm not really going to stretch the hamstrings or the glutes. I'm only stretching the low back. So I really want to try to open those sits bones up towards the ceiling, drop the pubic bone down, and shift that stretch. Oh yeah. Maybe bending the knees or pedaling, what we call pedaling, so bending and straightening, one and then the other, so we're alternating. And whenever you've had enough of this one, slowly come out of it. So you'll just slowly lift the head first and then walk those feet in. So head lifts up, walk those feet in. Keep holding on to the chair until you know for sure that you've overcome any dizziness or lightheadedness. Now let's take a break, y'all. So come on down for your final relaxation. I will demo again, but I'm going to do it really quickly. One of the really beneficial postures of putting the legs up in the chair for your final relaxation. So if you're not planning on doing that, you can just watch for giggles, but basically start getting ready and relaxed. If you are going to do this, you'll want to come down possibly like so. I recommend trying to come down to the knee and hip, and then sending those feet out in front of you. Moving the hips to the front corner of your chair. The reason why you're doing this is so that when you flip onto your back, you're in the right position. You don't have to shift around too much. So coming down, again, maybe shifting those hips so that they're touching the leg of the chair. Rolling on to that back. And legs move up into that chair. This is such a good position for the low back, for the circulatory system. Except when you have a microphone box digging into your hip. All right. So finding relaxation wherever you are. Closing the eyes. Feeling the heaviness and full release of the body. You worked your muscles and joints really hard today. And so giving this time to release is important in the process of creating change. Relaxing the jaw and the eyebrows, the fingers and the toes, and any other small little areas that we tend to hold tension without realizing. your next inhale, draw it deep down into the body, feeling the belly rise. Maybe moving the fingers and the toes. And taking a few more of those deep, full diaphragmatic breaths as you start to wake up the body again. And if you feel like you haven't rested long enough, please just stay where you are as long as you would like to. Rolling now the ankles and the wrists. Keeping the eyelids heavy though if you can, trying not to open those eyes. Maybe stretching out arms and legs. Now blinking the eyes open and slowly coming up to a seated position. If you're on the ground, again, I'm going to move probably a lot faster than you would, but you will tuck the knees a little bit and slide those legs to either side off the chair, rolling on to your side. And then using your hands, and I like to use like with my IQ with my seniors to kind of push out with that top leg. So as I'm pushing into this hand, I'm pushing out with the top leg to kind of use that momentum to help me. And then you have the chair here for support to get up off the ground. So probably what's best here is to try to roll onto the knees using that chair. And then coming on up. Okay, everyone. Thank you so much for joining me today. May this power that is ever present within you shine out through every thought, every action, and every word. Namaste. And just remember, you don't have to say namaste, but I'm saying it as a sign of respect and love and gratitude to all of you out there who are doing this practice with me today. And if you have any questions, comments, please reach out. Hope you feel wonderful and keep that feeling with you as long as you can. I'll see you next time. Bye.